Good afternoon, and I realize it's still good morning to some of you. I am Kelly Perales, co-director of the Midwest PBIS Network and a center partner. I am thrilled to be with you today in this second session of our mental health integration strand. Joining me today are Jennifer Kubitsta and Britta Santoni from Central School District in Oregon. And here in a little bit, we'll have an opportunity for them to introduce themselves and tell about their story of aligning and integrating school mental health and PBIS at the district level. Helping us out today, Susan Barrett is our content facilitator, so she'll be supporting responding to questions in the poll tab, as well as your reactions in chat. Katie Pullman is our tech assistant, and I know that out there in Pathable are many other thought partners and leaders in this work. And we really appreciate that you were able to join us live today for this session. Again, just a few reminders about our expectations. We hope that you are able to really be present today for this great information and are able to limit distractions, take care of yourself, and actively engage in dialogue and discussion through the chat and by entering questions into the polls tab. Because you are here live, I think by now you have figured out how to navigate the Pathable platform. And we really encourage you, when we're done here, I will put up the evaluation slide at the end. You can feel free to use all of the interaction features. And if you accidentally navigate away by clicking on a link in chat to a resource, you can easily find your way back by going back into the main page. If you really get stuck, you can go to the help desk where someone can assist you, especially if you're having any audio or inability to see the slides while they're being presented. Just a reminder, our sessions today and tomorrow are organized in strands. You are in the mental health integration strand. This is the second of 3 sessions. And so hopefully you had the opportunity already to listen to Susan, as well as Jessica Swain Bradway and Dr. Kurt Hatch talk about using the ISF to ensure equity in mental health in schools. And then coming up yet today will be a focus on school level implementation. And again, that is a great transition after this session, hearing about the really critical role of district and community leadership teams. I am really thrilled that throughout our forum yesterday and again so far today, we are really focusing on what we know to be true today, that we need to address our systems at the state, regional, district, and school level in order to systematically address mental health and social emotional wellness. One of the silver linings out of the last 19 months is that it has become a priority for schools and communities. And it is been really important for us to focus on prevention, early identification and intervention, being able to leverage our multi-tiered system of support to systematically manage anxiety, depression, and the impact of trauma, and being able to focus on flexibly meeting the needs of students, staff, and families in the current context, which requires us to put people and relationships above all else. And of course, next, we have to follow our data and what science tells us. And that is how we can create our single system of delivery. So I want to offer for you a definition around mental health and wellness. This comes from some colleagues in Florida that they developed through work that they did several years ago in a Project Aware grant. And we followed it up in a document that has some guidance for districts and schools around universal screening. But the big idea here is that we can't focus only on the positive or the deficits when we're thinking about competencies around mental health and wellness. In order to focus on mental health, we need to reduce the types of problems or risk factors and increase the competencies, life satisfaction, strong social relationships, those protective factors, so that we can really get to that idea of complete mental health. And in our schools, deliberately talking about and teaching social, emotional, behavioral, mental health strategies is the way in which we reduce those risk factors and improve protective factors. Why do we want to use a multi-tiered system of support to install any practice around social, emotional, behavioral health and wellness? Because what we're finding in the literature is that this is the way in which, through the public health model of prevention, we can establish accurate, durable, and scalable implementation. We can more efficiently support students identified with need, and we can use our data at the local school community level to build a continuum of evidence-based practices that will match the need. We start with the framework of PBIS because we have 24 years of evidence and data to say this is the multi-tiered system of support to support social, emotional, behavioral health and wellness. It's also beneficial for teachers inside schools and reduces exclusionary discipline. And so we want to focus on those systems, data, and practices that we've been talking with you about in every session throughout these last couple of days. And when we align and integrate in those core features, that's where we're going to be able to focus on that capacity building for all. And so no matter what related initiative or initiatives you have happening inside your schools and district, think about how the PBIS framework can be your framework to align and integrate your related initiatives. This is how we're going to be able to expand and enhance the work that you're already doing in order to make positive impact for students. And so whether you're talking about addressing substance misuse in schools, or integrating a trauma-informed approach, or focusing on teaching social emotional competencies, we have guidance, strategies, and recommendations for you to use that will help you align and integrate into your PBIS framework. I think by now you've heard about this new resource published last week from the US Department of Education. You will find in it that the Central School District received some recognition and was lifted up as an exemplar in doing this work. And really, it is showing you in this document how to use and think about PBIS as your multi-tiered system of support, and creating that integrated framework of educational, social, emotional, and behavioral health for all. And so I'm really excited that this document promotes the work that we've been working on together. And so what if school employed and community employed staff use local data to assess the needs of their young people, and together as an integrated team select practices that meet those needs? You will find some videos at pbis.org that give you just a snapshot of what it might mean to move from a co-located model to an integrated model. And you might be thinking about right now, all right, you're saying PBIS and MTSS and ISF, and those are lots of acronyms, and what do they all mean? What's different? What's the same? I offer for you this definition. You saw this in the first session of this strand as well. The big idea here is we are taking the PBIS framework and expanding and enhancing it to include community partners, elevating the voices and perspectives of families and students, and finding a way to create that single system of delivery. And so you have to decide in your context what you're going to call this work. And then you need to describe and define that for all of the groups who are part of your effort. And so what do we mean when we're talking about this interconnected systems framework? It's expanding your teams to include community mental health partners and other people in your community who care about this work. It's going beyond typical school data to include things like nurse visits and kids who leave the classroom environment to go see a counselor or social worker, and bringing in community data from child-serving systems like child welfare and juvenile justice, as well as other types of risk and protective factor data that you can get access to in your community. It's deliberately selecting and implementing practices together as a single set of teams. We're going to talk more about teams here in a minute. And so that includes whether you're a school-based employee or someone hired through a community organization. Using universal screening for social, emotional, behavioral risk, and using that data together with other data, not only to select interventions, but also to progress monitor both fidelity and impact. And all of this must be done with ongoing professional development, coaching, and technical assistance. And that's one of the #1 reasons why district and community leadership teams are so critical, because they can attend to all of these core features and make the necessary changes, whether that's policy or funding or how people spend their time, in order to help schools be successful in this work. If you want to read more about how to install and implement an interconnected system, not only are there videos and technical assistance briefs available online, we also have our 2nd volume of the ISF monograph. And now at PBIS.org, we have all of the chapters pieced out chapter by chapter, as well as the installation guides and all of the related tools, resources, and examples. And so for the purpose of this session, we're really focusing on chapter 4, which is district and community leadership and installation at the district level. And you'll find the installation guide and tools and resources there for that. These are the steps for district installation. We name them in the chapter as steps 1, 2, 3, 4, and 5. They all have sub-steps with tasks for leadership teams to work through with coaches and facilitators. I will tell you, though, that these steps are not linear. You know, we're talking about human service, we're talking about database decision-making, and we have to be sensitive to the fact that this is a continuous quality improvement model where, you know, we've heard this time and time again these last couple of days. It's a process, it takes time. We need to be patient and graceful, including with ourselves. So here's just a snapshot of that district installation guide. And again, it's really fantastic if you can have someone who's trained to do this work coach and facilitate the process with you. And before we get to talking a little bit more about teaming and then on to hearing from our exemplars, I do want to share with you some of the findings from our first random control trial, which was funded by the National Institute of Justice. The first major paper on this study has just been submitted for publication, actually at the very beginning of this week. And so I'm really excited to share with you some of this work. It is a study that took place down in the Southeast with 2 very large districts. We had a total of 24 elementary schools who were randomized into 3 different conditions. One of those being PBIS only, the second being PBIS plus school mental health, so clinicians from a community agency who came in and worked with typically a caseload of students. And we called that business as usual. They didn't receive any additional guidance from our implementation team. And then the third condition was interconnected systems framework, where For 2 straight school years, those teams with coaches both from mental health and the district received ongoing professional development, coaching, and technical assistance. And so here are some findings around the idea of teaming. And if you read this slide all on your own, you might be thinking about, wait a minute, more meetings that lasted longer? No, thank you, right? Everybody has too much to do already. But what this slide is really telling us is that when you looked at the 3 different study conditions, those who were implementing the ISF, first of all, tended to actually have regular meetings. So in the other 2 conditions, meetings either weren't scheduled or might have been scheduled and were likely to be canceled if other things took priority or precedent. And so in fact, in the ISF schools, they did tend to meet more frequently, and their meetings lasted longer because they had a great representation of multidisciplinary teams and were using data for problem solving, decision making, and action planning. And so therefore, in comparison to the other conditions, they did tend to meet longer. One of our key messages in the ISF is access is not enough. Oftentimes, historically in mental health, we counted if kids showed up for their sessions. And what we know is we have to move to outcomes. And that means progress monitoring with data to see if whatever the presenting problems are got better. And what you'll see here, again, if you read the bullets on this slide in isolation, you might be thinking, that sounds like access. And you know what? A lot of this piece is about connecting kids to appropriate interventions, but that's the first step, right? We've got to uncover need as early as we can and connect students to appropriate interventions. And so here what you see again is in comparison to PBIS only or PBIS plus school mental health business as usual, in this study, the ISF schools were more likely to proactively identify students using both universal screening data and other school community data and connecting them with appropriate interventions. And that was especially true for those students who were Black or non-Caucasian. And so what we also saw is that, again, when comparing the 3 conditions, the ISF schools had reduced in-school suspensions, office referrals, and in particular for students of color, reductions in out-of-school suspensions and office discipline referrals. And so we are really excited about those findings and have a subsequent study now funded by IES, Institute for Education Sciences, that we're just kicking off in 2 states with 2 different districts. And we have a study happening right now that is further drilling down into using the ISF and a focus on equity and disproportionality in discipline data based on some of the findings of our first study. So let's talk a little bit now about expanded teams, and then I'm going to hand it off to our friends from Oregon. The next couple of slides come from an article published by Dr. Joni Splett and some of our colleagues who've been, again, working on this idea of a single system of delivery with integrated teams in schools. And what you can see here is a little bit about collaboration and team functioning, database decision-making, and evidence-based practices. And further, we offer up, whether you're at the state level, the district level, or the school level, what are some of the critical responsibilities and who are some of the roles of people who should be at the table? And what you're going to hear here in a little bit is one of the most important factors that I think, and I'll speak for myself, I think is really critical, and that is leadership from the superintendent. If something is a priority to your superintendent, it's going to be a priority for everyone in your district. And so we need to really leverage those people with authority who can make decisions and really help schools be successful in this work. This is a graphic from our PBIS implementation blueprint. And here you see all of the executive functions and implementation functions of a district community leadership team. This same logic applies if you're at the school level, at the state level, or if you're even a regional person. What you want to be paying attention to are all of these functions so that you can develop a long-term strategic action plan, 3, 5, 10 years in the making, that will help your schools be successful in installing and implementing the ISF. And again, we use the blueprint from PBIS because we have the data and evidence to tell us that this system works. And so some of you have been hearing about the district systems fidelity inventory. This is just a snapshot of one of the areas around funding and alignment. But the big idea here is reinforcing the point that we have to examine all of the related initiatives, practices, and programs in our schools and find opportunities to be efficient and effective with our work. And so this is part of the installation process of the ISF. It's examining your current status and making a plan to cross-system really focus on a few things and do them really, really well. And so at this time, I'm going to pause. And again, I want to introduce our friends from Central School District, Jennifer and Britta. And Jennifer, I think you're going to kick us off here.
Thank you, and good morning to everyone. It's a little humbling when people say exemplar, because as we start to share, again, this is a work in progress, especially with some of the things we're going to share with everyone today. But we are, again, part of what we want to be able to do is share our story and share with you just things that we have learned and systems that we have put in place at the district level. I am the superintendent of Central School District. I am in my 5th year. But at times I remind everyone I have great leadership around me, and that's a lot of superintendents. The success is because of what you really have around you within your school district, with your students, et cetera. So just happy to be here. We're going to do real quickly to start. I think it's important to share data as a starting point. So I'm going to share a little bit about our school district, our strategic plan, and then we're going to get into really how we got here. And then share a little bit more of some of the things as we work through the pandemic time. So we can go to the next slide for me. So this is just a little bit of background. We are in rural Oregon. We are located just, for those people that do know Oregon, we're just about 10 miles from Salem, which is our capital, but we are considered in the rural area. We currently have 5 schools, currently because we're growing, so that may change here in the future. Our enrollment's about 3,200 students, but I think the most important thing for us is, and I knew this coming in as I applied for the position, that this school district would become a majority students of color, and that took place last year. So we are 53% of our students are of color. Again, below that you can see, but as we still, and this is one of our big initiatives, we have 95% of our staff that is white. That continues to diversify. We have several schools that have made some really great jumps in diversifying our workforce, and we'll continue to do that. We have 13% of our students experiencing disabilities, which is about the national average, but we do have 30% of emergent bilinguals or English language learners. That may be we in Oregon have shifted our language to emergent bilinguals. We think it's really important for our students to see themselves as having 2 languages as an asset. And so that's a language change. We still have to use EL because that's the federal codes, but those of you that may be at that federal or state level, that's a good shift of assets-based approach as we continue to talk through this. And then again, we're about, we from a socioeconomic disadvantage, we really filter between at times 58 to 62% throughout each year within our school district. I think one of the big questions is, I might be, for those of you that are on this phone call, well, this is a really small school district. I will tell you, I came from the 2nd largest school district in Washington, 32,000 students, 57 schools. This can be done in both big and small systems. Is it easier for us to maneuver in small? Yes and no, I will say. But this, I want to be clear, if you have questions and you are a bigger system, I don't normally talk about Tacoma because I am in Central now and this is our work here, but If you go Google Tacoma Whole Child, you will also see the work that this can be done at a very large level as well. But we're not going to talk about that. You can go do that research. But I think it's important to share that this can be done in different size school districts if you make it a priority. Can we go to the next slide, please? So I'm just going to touch base on, because I think this grounds us in our school district. We have 4 strategic goals focused around our students first, then our families, our partnerships that we have, and then the importance of where staff leadership comes in. So you see those goals on the right, and I'm not going to go into the details on the, on the left. On the right side is the vision statements that go with that. What I will say is we are a school district focused on the whole child. That means we are academically, behaviorally, and socially, emotionally making sure our students are prepared for college, career, and to be good community members. That is really our goal, focusing and coming out of K-12. Next slide for me. The next slide really focuses on, we did a lot of, when we built our strategic plan, it's really built from the community. It started from our student voices, then to our staff voices, then to our community. I want to highlight the first 2 specifically because that's really what our focus is today. You can see our 2 of our objective areas are focused on behavioral supports and tiered intervention to build that supportive learning environment. And then the second one is the mental health supports and social emotional learning with a trauma-informed lens as we develop the whole child. Again, these are the areas in our strategic plan that we continue to work through. These are the pillars of the work that we do. But again, we're going to focus on those top 2 as we talk today. But again, if you look at this, you can see where the academics start to fall in. You can also see the importance of extracurricular activities because we think that helps to develop a whole child. So again, all of this is connected. And then finally with this, as we talk about data, next slide for me, please. We talk about how we measure our progress. So our community identified these different data points. It is a mix of quantitative and qualitative data. We think this is important in the process because you have to measure. If you don't measure, then how are you going to know you're successful or where your areas of growth need to continue? So again, this is just a snapshot of the data that we are currently putting together. We have an internal really platform right now. That platform will be turning and be going in the fall publicly because that's important. Many of you may already have that platform in small rural areas. Sometimes we're not as far along. So we are looking forward to being able to share that moving forward. And again, these first 3 slides, I think it's important because this grounds our work. This is our strategic plan and everything works from our strategic plan as we build programming and do these together. So how do we get here? And I'm going to talk a little bit before I arrive and then talk through, if we can go to the next slide, how we were here. So first and foremost, and this was before my time, but one of the reasons I did come here is in 2005, we partnered with Salem Health, which is the local hospital organization that really is in the public health. And we have a health and wellness center, and it is actually called Central Health and Wellness Center. It is specific for our kids. They are the priority. They're the #1 people that get to come into that. At times, adults are second. If a kid walks in and needs support, an adult's there for an appointment, the student gets the priority over the adult. The center was specifically built to support our students within our community. And then obviously after that, our families that we have that we're working with. So that's how we started. The other reason I came down here, we were one of 2 high schools. The state of Oregon did a grant focused on trauma informed, specifically at the high school. We had a 3-year grant that has really grounded the work at the high school and has really developed a trauma informed approach in working with students. And we'll talk a little bit more about that as we go through this. When I came here, one of the first things that I knew I wanted to bring in, and again, Britta's going to share a little bit more, is I went and got Britta. We hired a whole child coordinator. Britta's background is mental health because it was important to me that I knew that we needed to make sure that mental health with the other frameworks that are allowing us to do this work was part of our team and helping to build this move forward. Also at that time, right before I hired Britta, I made the choice. There was some funding. And again, I'm sure a lot of people are asking questions about, well, how's this funding happen? In the state of Oregon, in partnerships with the businesses and within the school districts, there were lots of conversations. We have what's called a Student Success Act, and it was passed actually in 2019, but in prior year, I took the risk and implemented mental health professionals in every single one of our schools. The high school and middle school have school counselors and the mental health. Currently in our elementaries, we only have mental health, but that's a big conversation right now of potentially adding in school counselors there as we look towards the future. Because I think that was a big shift in some of the things that we were seeing with our students, and felt it was important to make that shift. This past year, because of what we were seeing from the pandemic, and we'll get into more detail of that, we added a bilingual mental health. Again, we have a large Latinx population. We're 45% students that are Latinx. And so we have added that in as an additional mental health person. We also added this fall a community coordinator, and that's actually funded through our county. And I'm going to talk a little bit about more of our county collaborative. And then we're going to share things about our school sites, et cetera. But really, I wanted to show this slide of it doesn't happen in a year. It doesn't happen in 2 years. This is an ongoing process of looking at your system and making adjustments based off of what your needs are for your students, first and foremost. Secondly, your staff. Third, your families. And fourth, the greater community, as we continue to talk through. How do we get here? If I go to the next slide, here's the partners that are involved in this. And we're going to go into more details about this, but I just want to give you a visual of what that looks like. We have great partnerships with our county. I am blessed to have the county people that we get to work with every single day. It's pretty amazing the work that we get to do. Is it messy? You bet it is. Have we sat at tables and had some really hard conversations? Of course we have. Has that been with law enforcement? You bet. A lot of people, I'm sure, saying, wow, how are they doing that with law enforcement? That can be a touchy area right now. We're going to share with you a couple of things that we have built that has really helped our systems in that partnership with law enforcement, which sometimes is a difficult conversation. And we're going to be very clear about that. These are not easy conversations. These are not things that happen overnight, but it's bringing people to the table and how you really support your students and community. So with that, let's transition to the next slide, and I'm going to turn it over to Britta from here. One of the key pieces when I first came here with the health center, with the trauma informed grant, is really, and then as we moved into with our mental health partners, is having to establish clear roles, like who does what, because as you start to work with partners, it can be very messy. And so I think it's really important. We're going to talk a little bit about what that looks like, and then the work that Britta has done in her role in really helping to develop these teams as we move forward. So again, a little bit of background for us, and now Britta's going to take on where we have from this point moved forward with our teams.
Awesome. Thank you, Jennifer. And like Jennifer said, I'm the whole child program coordinator for the Central School District. My background is in mental health. I am a licensed professional counselor and had worked in community mental health and private practice working with kids and adolescents and families, and then became a school-based mental health therapist. And just to say for a second, and we'll get into this more, in that role, as soon as I moved into schools, which was partly the desire to be where we can get the services to the kids that need it the most and to the biggest number of kids who need it. And then really quickly saw the need for systems that support not only students, but staff as well around mental health, and just kind of realized I could ask for 10 more therapists in this building I'm in, and it still might not be enough. And I'm really pro therapist. It still might not be enough if we don't have the systems in place that really provide lasting support for our students and staff and families. So I'll say that. So some of on the next slide is a sample of what Jennifer talked about in terms of role clarification. We have Polk County, our county behavioral health therapists working at our student health center. We have our school-based mental health team who are also county employees, but have offices in our buildings. They are part of tier 1, tier 2, tier 3 teams in our buildings. They are a part of, you wouldn't know they weren't just school staff doing the things with our staff in the buildings. And then we, of course, have our school counselors who are school employees. And so this was just a sample of some of that role clarification we did to help communicate who is doing what, which was helpful for these helpers themselves, but also in how we share that with staff, how we establish some of the referral process, and just provide clarification with that. This is a work in progress. So I show this as an exemplar and I see like 10 things we're working on to switch up and change, but just a sample of sort of how we started with that. And we can go to the next one. With one of those initial teams, this was before I got here also, some of those community partners with the student health center, with our county behavioral health, with some of our school staff, they drilled down a little deeper even in identifying, this is for the high school specifically, a document that kind of broke down which types of support. So you'll see mental health, physical health, behavior, attendance, and we know those are mushed together and crossover, but in terms of trying to organize what's being provided where and what type of tier 1, tier 2, tier 3 supports do we have in those areas and where. So you'll see on this document, this is what happens at the Health and Wellness Center. This is what's provided by behavioral health, to kind of just get into it a little further. With hashing that out for teams and for our providers and clarification of what's going on. This has been really helpful now as we start to, as we've grown in the type of data that we have and that we're collecting, to look at what's going on and is it actually addressing what our data is telling us about needs. And where are some gaps and that sort of thing. Again, another work in progress document, but just sort of a sample of one way of organizing some of the supports that you may have going. We can skip to the next one, Kelly. And so the next part of when I started in this role with my superintendent, Jennifer, who's on board and raring to go with this stuff and just ahead of the game. But part of that was she brought me on, it was pre-COVID, but like the December before the spring, the spring, the March of COVID. So I hadn't been there that long. And part of what we started off with was just, she said, Britta, just go and see what's happening and meet with teams and get to know teams. And I started looking at it as kind of a therapist, I'm doing like case conceptualization for the whole district. And I don't try to therapize everyone or diagnose everyone, I promise, but what's going on and what do we have and what's happening and what teams are happening and how is it going? And especially at the district level. And I, at that point, had been working in schools enough to know that whatever we do with this, we need to make sure that as we're asking people to be part of different planning or part of different teams or make changes, that we do that in a way that communicates that we value their time and their energy and their knowledge and just hold it that way. And so part of that process, then what we did on the next slide is a sample. So these are some graphics of how we sort of put together to show. So it's a series. This one shows we had some amazing work being done with a bunch of different teams all over the place. And these were all like well-intentioned, actually getting a lot done teams. And knowledge was being shared and things were being planned, but it was team after team after team meeting with a lot of the same people. And so we started to look at how can we consolidate and reformat this in a way that really honors people's time to where we can get the work done in maybe a more efficient way. So the next slide is part of what we tried to do. So the with the ISF format, they call it the district community leadership team. And in our district, that's a team made up of that list that Jennifer showed, with our community partners from behavioral health and the county supports, and our medical providers, and some of our first responders, a lot of people from the school district, but together, where we're looking at community data and we're identifying needs and we're doing planning together. So that's that core district community leadership team. And then we decided to divide the work that all those other teams were doing into these 3 categories, which you'll recognize. I didn't come up with this language myself. Thank you, PBIS and ISF framework, but we've got our whole child support system support. So kind of how are we, the 3-tiered continuum of culturally relevant, evidence-based interventions. What do we have to use that we know works and that we know is actually addressing the need that's the real need? And then staff development, and then identifying student needs. So the data kind of development in those categories. And then the idea was that on the next slide, sometimes some of those different categories, smaller work groups, if we, for example, our focus was building a 3-year professional development plan, and we had a team with teachers and building staff and others that were representative of who needed to be a part of that, kind of working on that, they would join our monthly district community leadership team that includes all those community partners and leaders in the other areas to be part of that when that's our focus in what we're working on then. And so that was, we were kind of seeing some movement with that and some growth and awesome connections with our community partners, and how that included them in looking at what students need and how are we addressing that as a whole community and then in the school district. And we were rocking and rolling. And then the next slide, dun, 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 is, I think all of you. Then there's the pre-COVID and then there's the COVID situation. And so this is where some of that came to a screeching halt, but not all of it. And so we've been able to see now, whereas sample before 3-year professional development plan, I was working on that with the team. Then all of a sudden we're working on next week's virtual learning for classified staff who are trying to work from home and get all their hours done, right? Not what we were planning to do, not what I ever thought I'd be doing, but just all the shifts. So I'm going to pass it back to Jennifer to kind of look at how this ISF work supported where we were when COVID hit, and then what we've prioritized since then.
Thanks, Britta. So if we go to the next slide, and we all felt this in very different ways. We had to make a major shift. We were seeing, just based off of what was happening, not only with our students, but with our staff and our community. We shifted our priorities of really making sure that our systems had what they needed to work through this pandemic. And I will say we are still working through it. I think many of us are still working through it in different ways. So we had 3 priorities that we focused on, and you can see them here. I'm going to start with the 3rd bullet and you're going to hear more about this, but this was a huge part of shifting what we did. I am a big believer in student, staff, and community voice. That is the leadership of school districts. And when I talk leadership within a school district, I am not only talking about my board, I am talking about my union leadership and my licensed and classified, or however many unions you may have. That is my administrative team. That is our students. That is our parents and community. And that is a huge part of that. We became very vulnerable, and I say that. There were things that were shared with me that were really hard to hear from staff, from students, but those voices and the leadership that we have had as we went through this process is partly where we are today. It is still a struggle. My system is very stressed. I think a lot of systems across the country are very stressed, but that collaborative voices and leadership is helping us maneuver that. I will also say, when you have voices at the table, not everyone agrees with you. You still need to allow those voices at the table. One of the things I think I take great pride in right now in our community, we are very diverse. I don't like to talk politics, but we are very diverse from a political, socioeconomic, ethnicity, just generally the diverseness of our community is what is at times the most difficult, but also makes us very strong. So I think it's really important that voices and leaderships, as you have these conversations, and you need to have the voices that do not agree with you. They have to have a seat at the table to continue those conversations and doing the work and what's right and just for our students. So that's the first part. Another big piece of that, obviously, when you get those voices, equity. I told the board when they hired me, look, I need to be very clear. Educational equity is one of my core values. And if we're not going to do that work, then I'm probably not the right superintendent for you. And we're going to talk a little bit more about what that looks like within our school district. But again, that was a huge part of the pandemic. When we talked about this, the first two things when I talked about equity, because we were completely shut down, was we made sure everyone had access to internet. And that's hard in a rural area. We are not like the urbans. And I know even in the urban settings, that was difficult. So just a couple examples of that were making sure everybody had internet access and making sure everyone had a device that they could use so they could continue their learning. And then lastly, which again, I give great credit to Britta, although at times she's going to say, Jen, you helped do this. Our priority of last year, and I was very clear with my board, very clear with the community. Yes, we were going to focus on academics, but my priority was the wellness of our students and staff. That meant the mental health wellness, that meant the day-to-day wellness, that basic Maslow hierarchy of needs, nutrition, et cetera, and making sure that that was a huge part of what we are building within our system. So I'm going to turn it back over to Britta to share a little bit more detail of what that actually looked like.
We can go to the next slide. Oh, thank you. So this student and staff wellness, I think pre-COVID, we were trying to convince people, right? Still trying to convince people that this was a priority. And man, all of a sudden, right in our faces, that this, if it has to be, because we've got to get through this. We've got to get through this together. Our adults have to be okay in order for our kids and our students to be okay. And a lot of times we were not okay. And what are we going to do to help each other and support each other and build resilience? So we started, we had been, and it became even a bigger mantra, mental health for all. What does that mean? What does that look like? And what we started to say it looked like is things I've heard already today from others, is that it looked like providing routine and predictability for our students, even virtually, like battling for that, for the same time and the same activities and repetition and showing up online. And it looked like never giving up on building and maintaining relationships and connections with our students and families. Jennifer leading those community groups throughout that whole first summer that had voices from all over town and all over opinions and all of that, but continuing to show up even when people were mad and frustrated and had really different opinions than what we had to choose to go with, and our superintendent continuing to show up to be there to maintain those connections along with school staff. It looked like porch visits and parking lot visits and sidewalk visits with our mental health team and with teachers and staff, and switching to telehealth in 5 seconds when you'd never done it before, which I can't see all of you who are out there, but I can't imagine all the things that you did that you could have on your list of what that meant for you in the past year and a half. But it meant all those things you didn't expect. Here's my fall example. It looked like our ag teachers, we have agriculture, picking up pumpkins from nearby farms, delivering them to first grade teachers outside, first grade teachers dressing up in crazy fall costumes and doing a drive-through pumpkin patch for first graders who didn't get to do their first grade field trip. during the pandemic. And this year they're in the building. So they had high school students create pumpkin patches on our elementary school campuses for students because we don't have enough buses to get to field trips this year. We're understaffed, right? Like a lot of you around the country and the world. But that's what it looks like. And we count that as mental health work because it's climate work and it's culture work and it's connection work. It also looks like our nutrition services and our transportation team being considered part of our mental health team because they fed our kids and they fed our kids and they fed our kids. And when not all families could get to the building to get food, they took it to them. And they didn't give up on that. We used a staff care and connection survey. Some of this is little things that I'm still going to talk about because the little things make the big things. And with that staff care and connection survey, we did it strategically to use information to get staff voice on what we did, but also to be able to highlight, I'm going to find my questions, to highlight community resilience and to be able to talk about the we of who we are as a community and getting through this stuff in a way that was real and was informed by our staff voice, not Britta saying warm and fuzzy things and just wanting it to be true, or Jennifer as the superintendent, but really using staff voice in that. Also from that survey, you can be creative, and we got one song from every staff member that gives them a boost of joy. And I've got a bank of playlists of joy songs for each building in our district. That's a free gift to give out to staff. We've got something each person was proud of or kind of pumped about from over the summer. We have information about what they were proud of their team for in the last year, which, by the way, also happens to tie really closely to factors that we know promote resilience. And we could turn that around and teach community and collective care and resilience around what they told us they were doing already. And it gave me drive-through drink orders for every staff member that I could pass off, that I could package neatly and give off to building admin or their care teams or whoever, that now has everyone's favorite drink, which is again a little thing, but you know those days where that little thing is a big thing and we need it for each other. We started off the fall of 2020 by doing bliss lists as an entire school district, and our superintendent led that activity. Oh, there it is. And she created her bliss list and she showed it to the staff and she walked them through it. And it was permission from the highest level of leadership to take care of yourself however you can in the day in ways that you need, and you've got permission and support to do that. And vulnerability at the same time. Small ways that leaders can create permission to be vulnerable and brave in our spaces. We didn't stop at talking about self-care because we know you can be perfect at taking care of yourself, and this year is still really hard and really challenging, and it's not about how good you are at self-care. So we made sure that we talked also about how are we building systems and district level support for staff.
Hey, Britta, real quickly, because there's a question. So there's a question about what was the staff care and connections? What did it actually capture? So what specific things did that survey, just from a question perspective? Can you add a little bit more to that?
Right. It's simple. This is the Britta version of what do I want to know? And then what can we do with it? So the questions really were, what is something about your school or work culture that made you proud last year? What is something you accomplished over the summer that you're pumped about? And we had anywhere from took a nap to climbed a mountain, literally. And we were able to use that info to get prizes and fun things that we can hand out when we open the year. We do not undervalue fun and playfulness wherever we can. And that's hard to fight for right now, but we fight for that because it's a big deal in terms of the opposite of what the stress and the trauma of what people have experienced. If we can activate that fun, playful part of our brains, we're trying to take every opportunity we can for that for adults too, not just for students, but definitely for students where we can. I ask always, are you okay with being celebrated publicly? And make sure they know what that means so they can say, Britta, don't you dare give me a prize in front of the whole district or in front of the staff meeting. We did drive-through coffee or drink order, and we did a song that gives you a boost of joy. And that was it. And from that, we took that information and we plug it in where we can when we do other professional learning around resilience or collective care, or even just having things to give to building teams to start staff meetings and different activities.
I would also add it allows, because I do have, as a superintendent, Britta gives me access to that. And again, that's where that trust is. It allows us to have stories to be able to take, and it helps in what I do for messaging with our staff. We can reference that. Britta and I work really hard on, and Britta does this once a month, but as we communicate out, just reminders of that, going back to the playlist. I can't tell you how many times in my car, if I'm coming or going to a rough meeting, I just put on one of those playlists from the school to remind myself. And again, a lot of our staff do this. It's a huge part of what we use to help message out that this is a priority of taking care of ourselves first and foremost. A lot of times I say to our staff, if you don't take care of you, how are you going to take care of our students? So there's a real correlation between those two to do this work, especially because we are in the people business.
We led virtual staff wellness groups twice a week that were during their contracted hours. That was okay to come and be a part of those during your work hours. We can go to the next slide. I'm taking too long on this, I can tell. This is what mental health for all looks like. I know this is a busy slide, but I had to put our people doing their things, handing out food, dressed up like crayons for drive-through things. One of our elementary PE teachers, who has taught for 32 years, is still teaching and switched over to virtual like a total rock star. That top picture with 2 thumbs up, Ashley Hunt, is one of our Polk County employees who is in it with everyone else. Our mental health team is in this, doing these things with our school staff. I know you all have pictures of your people like this. So let's move on. We were able to start the Handle with Care program. If you haven't heard of that, I encourage you to look that up, where we have a system with first responders in our community to alert us if there's something that has gone on that a student is impacted by in the community with law enforcement or other first responders. We're careful with confidentiality and how we train staff in receiving those notifications and who has access to that. But that has really helped to collaborate with trauma-informed perspective and care with our community first responders and how we do that together. Even shared training, that we can do common training together around some of that. We were able to get a grant with our community partners. So behavioral health wrote the grant. The school district got to spend the money and do the legwork around this. But we had data and information that told us our Spanish speaking families and students were not able to connect to the same type of mental health support. And we just got a gap. We've got a gap there. And one of the things we were able to do was get that grant specifically with our Spanish speaking families in mind. And we're able to create a mental health awareness campaign and video, and that will continue all year based on that information. But this was also planned and created and dreamed by our own students and family members and staff members who are Spanish speaking, who are Latinx. It wasn't middle-aged white Britta's voice doing this work because that's not whose voice needed to be centered in that. And we've included the link to that video and campaign and want you all to take it and use it if you think that it would be relevant for wherever you are. We've been able to expand the school-based mental health team And our district community leadership team, that ISF team that is the one with the community leaders and the stakeholders who can make those big decisions, is really right now one of our teams, one of our only district level teams that is still meeting, that brings in building people and brings in community people, because we've streamlined what's going on right now with the stress level and how stretched everyone are. But that team, we are in it to win it with those community partners. And we have dug even deeper in how we're looking at data as a group for our students in our community. Like, how do we know how people are doing and what the needs are, to pull district data, community data and information to try to figure out how we can provide support and interventions based on that, drawing from all the resources we have. And just one quick reminder that staff care and staff well-being is equity work, that stressed brains that are so stretched out are not in a great place for empathy. They're not in a great place for checking our own biases. Caring for the mental health of all the adults involved is essential in moving the equity work forward as well.
Hey, Britta, two things. One is, can you share when you did the activities with our staff, the twice a week, just share a couple of the, things that you did with staff. That's one of the questions that was asked. And then I want to talk a little bit more about the handle with care as well. So just share a couple things that were within those meetings when staff joined.
Well, a lot of that was the same concern for staff that I know a lot of you had for students during that, if it was only distance learning, wanting to make sure there weren't people that were invisible, that we just didn't know how they were doing and what was going on. So part of it was that connection time. It did not become group therapy. We kept it really structured. So, or individual therapy in the presence of others. I wanted to be careful that that's not what that time was for. So it was very structured, but some kind of check-in. And then, for example, like teaching Name It to Tame It, teaching different mindfulness strategies or relaxation breathing and practicing it together. We tried to be really intentional about whatever we did in that group with adults, they could turn around and use it with students. So some of those lessons were mimicked that we used with staff were also mimicked in our SEL lessons for our advisory time with high school students. So we did Name It to Tame It with adults that week, and at the high school, they were doing Name It to Tame It in their advisory class that week, to where it was not just one place, but could be used with students as well. And I had a magical day working from home, my whole family being at home, where I did one breathing strategy with a group early in the morning, a group of adults. And then later that afternoon, heard my 4th grade son in a class meeting with his teacher, who had been in that early morning meeting doing the same breathing exercise with his class then, which felt pretty magical, right? Like something's rolling.
The one thing I want to add, thanks for sharing that, Britta. And I think that was huge because I was hearing that as a superintendent of, again, that focus of taking care of students is our priority. I think if you don't know anything about the Handle with Care, I'm going to take a minute to do this, because I will tell you, we have seen more of this year than we did prior. And I think that has been, and I'm going to be very clear, I was a little hesitant when they brought it to me. Because again, this is that continued partnership with law enforcement. Again, we have a great partnership with them. That doesn't mean we haven't had struggles here in our community, but this has been an amazing thing to allow us at 2:00 in the morning to get an email that very clearly says, please handle this student with care. There was an issue last night. That allows us, again, we don't get much more detail than that, but what it allows us to do is there's a team of us that can quickly turn around, get it to a principal, get it to the counselors to make sure if that student walks in, that we are making sure that that student has care and connection and are being able to move in and support where we need to because of that program. I can't say that enough. I think we've had, unfortunately, more of reports. I think 3 times more of the reports than we did last year. already this year. And I think that's still some of the impact we're seeing from the pandemic and some of the things we're having to work through within our community. I think it's really important, if you don't have, it's worth taking a look at that, because I would have never thought that it would impact our system as much as it has done.
And I think we're ready to move on for the next slide with Jennifer.
Yeah, so I'm just going to highlight again, Britta has shared, I think, again, it's really important, and it is hard and it is messy. But as you do this work, it is imperative that you have voices at the table. You have to have student voices. You know, I go in and I'm in the process of working through that right now to gather data from our students to what their voices are. Britta talked about, we have a community committee that met virtually, literally from May of 2020 all the way through this past year. We met monthly. We brought problems of practice to them. They pushed on us of other things. They helped us make decisions. We'd highlight some things that were of importance, and then we'd go into breakout rooms to gather information. It was a huge part of our decision making and how you do the work within the community. That part of that was, our partners were part of that. So again, those voices were students, families, community partners, and our staff. That mix at times was hard, very difficult conversations, especially when we were in spaces where we were in smaller groups. There were some really difficult conversations and facilitation that took place, but it allowed us to make really hard decisions. Not everyone agreed, but we were making the decisions that were both right and just for our students, depending on the situation or the data that we were having as we continued to work through the pandemic, especially when we were closed down. I think the other piece we did that I just want to highlight, and we're sort of continuing this year, is we actually worked very hard with our unions to have a staff evaluation we had really 3 goals, a personal goal, but the other 2 goals were, how are you developing the social emotional learning with your students? And then how do you develop a goal focused on family engagement? So there were things like, I'm going to make sure that I've touched base with 90% of my students every month to make sure that they know that they have a connection with me, and kept data like that. And that's how we work through our evaluation. This year, we've given grace to our licensed staff and our classified staff a professional growth goal focused on their wellness. So I think we are really being adaptable to where we are listening to the voices, what their needs are, and continuing to have that leadership. That is a very important part of this as you continue that work. And you just got to find the people. You just start small, right? And you just keep bringing people along, and people will hear things. If we go to the next slide, I guess is really our last slide that I want to focus on. Again, Britta has talked about the basic needs. That was a huge part of, from an equity standpoint, that we started with coming out of the pandemic. I think the other piece, as I shared previously, was, we gave a device and it was hard, and we know that there's going to be some losses from a funding end, but I didn't care, right? This is about our students and making sure they had the resources and tools for them to be successful in a very different environment. But I think the biggest thing we did last year, and really as the pandemic was coming on and then through the pandemic, is we have an amazing district equity team that is a balance of our licensed, classified, and administrative leadership, as well as board leadership. We have, and you'll see here, this is our purpose. We are very intentional of being actively anti-racist. And I want to be clear, I'm in a community where there is white supremacy. We have to work through it every day. So we understand that this work can be very difficult, but when you are a community that is 53% students of color, this is the work that we need to do to make sure our students are supported, that they're getting the education that they deserve. So we are actively working on being anti-racist leaders. Again, you've heard me talk about the importance of voice. Again, that's all voices, hard to hear, but it's important that you have those voices at the table. We are working towards, when we adopt curriculum, that our students see themselves, right? Culturally responsive practices within our educational from a day-to-day perspective. We have our building spaces that are purposeful and vulnerable. We're moving into building affinity groups within our staff. We have even that established already with some of our student groups we're excited about. And then again, how do we continue to give tools, professional learning and training? I had a group of about really representatives of our district, because we have a building equity teams. They went through a very intense training over the summer focused on equity, anti-racism, culturally responsive teaching, restorative practices. If this is not part of your work, and I'm going to push if there are superintendents or leaders that are in the district office, this needs to continue to be a focus, especially with the diversity of our communities continuing to change. This is vital to the success of our students. It's vital for us to continue to diversify our communities, so kids see others that look like them in those roles. And that's really important to us. I have a young teacher, Latina teacher, who was a student teacher 4 years ago with us, who always says to me, Dr. Kabisa, I'm going to take your job. I'm helping her do that. I want her to be able to potentially be one day, if she wants to be a superintendent, I'm going to make sure that she gets there. So this is a really important piece. If you go to the next slide, Brenda's going to talk about, there's going to be some resources there, but if you do go to our website and you click on departments, you're going to see a link that talks about equity and access. The last thing I'll share, we had a small committee that did definitions. We don't have all the definitions there. You may not agree with our definitions, but these are definitions that our community, our staff work collectively together, because it is important to educate the community as much it is to educate our students and continue that professional learning with our staff. So Britta, I'm going to turn over to you to just talk through some of these documents, and then we can open up for other questions.
Sure. These are just the samples that you saw in previous slides. And then with kind of how we did the role clarification with different mental health helpers and counselors in our buildings. And then the one with what supports are being offered where through the tiers, that was in a previous slide. And then there's a link to our equity and access webpage. And then our Valores Cambio, our mental health awareness campaign, Courage Equals Change. I just kind of want you all to see our students and our families in that, because it's great. And you may have similar things, but please take it and use it if you can find that to be helpful wherever you are. And I didn't say this earlier, but I think it took some miraculous action and planning to get you to have this much time on this day to be in a conference like this when you are working in schools right now. And so I am so grateful and impressed that you were able to do that, to be here and to commit yourself to learning and growing. I can't imagine all the things you've already done today with students and staff in schools. So thank you. Thank you for being here and committing to this work.
Wow. Jennifer, Britta, thank you so much. I hope you're able to see some of the comments in chat as we begin to close out our time together. Appreciate everyone's active participation. And again, if you have any last minute questions, feel free to put those in the polls pod. And here are just a few extra resources. This is a technical assistance guide on installing and implementing at the district community level. And it also has a case study as well as suggested recommendations and strategies. And I know that Susan and Katie have been putting resources in the chat throughout our time together, but please check out our website with, again, videos, short illustrations of the work, longer narratives and chapters, and reach out to us if you have other questions. And please continue to take care of yourselves and each other. I am really glad that that has been highlighted here today. And before you go, take a minute to complete your evaluation of this session.